Hi, I'm Sharon Davis. This is my client, Mr. Davis. We're here to do a full physical head-to-toe assessment on Mr. Davis. Prior to this exam, I conducted an interview with him to evaluate for any health issues that he's been having. The only issues that he verbalized to me were sinus issues and seasonal allergies, which manifest themselves with itchy, watery eyes and some sinus congestion and pressure. He doesn't take any medications prescription. He does take some over-the-counter sinus medications, antihistamines, to deal with the sinus problems. He is on a weight control and exercise program with the goal being to lose some weight and gain some muscle mass. I'm going to begin this interview with having him walk back and forth across the room to test motor function and to just evaluate his gait and his posture. If you could just walk across the room for me, Mr. Davis. Excellent. And if you could now walk heel to toe across the room. Okay, that's great. You can stop right there and come back to the center of the room and just hop on one foot for me. Good. And the other foot. Fantastic. I'm going to now evaluate the range of motion of your spine, and following that, I'll be looking at the curvature of your spine. If you could just reach down as if you were going to touch your toes. Good. And then back up. And if you could bend to the right and to the left. And now to the back. Great. You have great range of motion of your spine. All right, now I'm going to look at your spine, checking your shoulders to see if they're even, and looking for curvature of the spine for scoliosis. You have a slight curve in the thoracic spine. Okay, you can stand back up. Hip bones were level. While you're standing, I'm going to have you step back here at 20 feet, and we're going to look at an eye chart. I'm going to have you cover your left eye. We're using the Snellen eye chart. Cover your left eye and read the smallest line that you can read.
F, D, P, L, T, C, E, O.
Okay, and now the other eye.
F, D, P, L, T, C, E, O.
Good, and then both eyes. F,
D, P, L, T, C, E, O.
Good. Your vision is 2013. Now, if I could just get you to read a few lines on this card for me at about 14 to 18 inches.
As a gift from us to you, 20% off all shop items.
Very good. Okay, thank you. All right, and if I could have you come and sit on the table for me. Prior to this assessment, I did a full skin assessment on the areas that are now going to be covered. The anterior chest, the posterior chest, and the abdomen. There were no lesions, no moles, there were no skin irregularities. The skin was pink, warm, and dry. We'll be commenting on the other skin areas that we can see. I want to start with a scalp assessment. For this, I'll be looking at the scalp for lesions, for hair pattern, for any moles, the hair is curly and coarse. There's some male pattern baldness right in the crown. Now palpating for any nodules. Kind of a scalp massage, isn't it? I don't feel any lesions or nodules. And now I'm going to come and palpate the suboccipital nodes. There's no lymphadenopathy there. I'm going to come around and palpate the preauricular nodes and the postauricular nodes, the submandibular nodes, and submaxillary nodes, and then come down to the cervical nodes. The supraclavicular nodes. Okay, I'm going to now palpate the external ear for any tenderness. I didn't feel any lymphadenopathy in any of the nodes. Do you have any tenderness in your ear? Okay. And now palpating the sinuses. Do you have any tenderness in your frontal sinuses? In your maxillary sinuses? No? I'm going to palpate the temporal arteries. And they're even. I'm going to come down here now and listen and feel for your carotid arteries. Feeling for the amplitude and the regularity of the rate. And now I'm going to listen to the carotid arteries for bruits using the bell of the stethoscope. While I've got the stethoscope, I'm going to go ahead and listen at the point of maximum impulse for aortic stenosis. So if I could get you to lean forward for me. I do not hear any murmurs there. Okay. Okay. Going back to the face. I need for you to, well, I'm going to begin by looking in your eyes for pupillary accommodation. That is your optic nerve. That's cranial nerve 2. I'm looking for the pupils to constrict evenly on both sides. The pupils are equal and reactive to light. I now want to check for the olfactory nerve. That's cranial nerve 1. So I need for you to close your eyes, and I'm going to give you 2 things to smell, one at a time. First, I want to check the patency of your nose. So if you will block your nose with one finger, block one side, and breathe in. Good. And then the other side. Excellent. Okay, now if you'll close your eyes and smell for me. What is that?
That's coffee.
Okay. And now another smell.
That smells like cinnamon.
Okay, good. That is correct. Okay, now if I can get you to raise your eyebrows for me. Good. And close your eyes. Okay. And then open your eyes against resistance. Good. Okay. I'm checking for cranial nerve 3, 4, and 6 with your eyes, the cardinal fields of vision and peripheral fields of vision. Also, the muscle tone in your eyes. So I'm going to start with the peripheral. If you will let me know, I'm going to put 2 fingers on each side. Let me know when you can see them as I bring them in.
I can see them.
You can see them. You have great peripheral vision. Okay. And then I want to do the cardinal gazes. If you will, without moving your head, if you'll follow my finger with your eyes. Good. Cranial nerve 3, 4, and 6 are intact. Now, if you can puff out your cheeks for me, smile for me. Okay. Push your tongue out in your cheek. Good. Push your tongue out in your cheek. Okay. If you can turn your head against resistance. Good. Excellent. And turn your head against resistance. Good. And shrug your shoulders against resistance. Good. It's checking for cranial nerve 11. Cranial nerve 7 is tested with the smiling and puffing cheeks. I'm going to look now at your eyes, starting just with the sclera and the lacrimal ducts. If you'll look down for me. Okay, and up for me. Excellent. I don't see any exudate. Sclera is light. Good. Okay. I want to look in your ears now. You have a fair amount of wax built up in the right ear canal. I can see the drum. It's pearly gray. I can see the light reflex there. Do you have any tenderness when I'm doing this?
No, ma'am.
Okay. Much less wax on this ear. Again, I can see the drum and the light reflex. Any tenderness on this side?
No, ma'am.
Okay, great. I want to test cranial nerve 8. Whispering in your ear, I'm just going to say a couple of words on each side, and if you could just tell me if you can hear what I'm saying.
Good morning, Mr. Davis.
Good.
It's raining.
Very good. Cranial nerve 8's intact. Now I'm going to test for lateralization. When I strike this tuning fork, I'm going to put it on the top of your head, and what I need for you to tell me is if you hear this more on one side, on the other side, or in the center.
It's in the center.
Good. Okay. And now for air conduction and bone conduction, that was the Weber test. This is the Rhine test for air conduction and bone conduction. I'm going to strike the tuning fork, and I'm going to put it to your mastoid bone. Let me know when you can no longer hear the sound at the mastoid bone, and then I'm going to move it in front of your ear, and you tell me if you can still hear it. We'll do that on both sides.
I can't hear it there.
appears to be no hearing loss. Okay, I'm going to look at your, well, palpate your nose first and looking for any deviation in your nasal bone. Any tenderness here?
Nope.
Okay, I want to look in your nose. Okay, if you could just hold your head back for me. Just looking for any polyps, excuse me. Looking for any polyps, any exudate, any bloody discharge, and everything looks fine there. Okay. Now I want to look in your mouth.